Welcome back, Endo superheroes. Today, we're going on an adventure, not into a forest, not into a cave, but deep inside the mysterious world of the root canal cave. And in this adventure, one thing decides whether you succeed or get completely lost. Here is your quick mind map for today's lesson. Everything in this video will revolve around three major pillars of endodontic success. Pillar number 1. Working length. You will learn what working length is, why it matters, the APEX checklist, and how to use the electronic apex locator correctly. Pillar number 2, glide path. We will discuss what the glide path does, why rotary files depend on it, and the simple SSP steps: scout, smooth, and prepare. Pillar number 3, apical patency. You will understand why patency prevents blockages, how to perform it safely, and the FLOW technique. And finally, we will cover the most common mistakes students make, followed by a quick quiz to lock the information in. This is your roadmap for today: working length, glide path, and apical patency. 3 essential skills that transform you from a dental student into a confident endo explorer. Let's begin. Working length. If your length is wrong, everything after it collapses. But if your length is perfect, you become the ruler of endodontics. So what exactly is working length? Imagine you're an explorer walking inside a narrow tunnel. You have a flashlight, a tiny file, and only one mission: reach the door of the apical constriction. Not go through it, not stop way before it, but stop right at it, about 0.5 to 1 millimeter short of the apex. That's your golden zone. Why does this matter? If you stop too short, you leave zombies behind, necrotic tissue sitting there waiting to cause trouble. Too long, you poke the periapex like a needle, irritate tissues, and your patient will definitely remember you. But the correct working length? That's where perfect cleaning and beautiful obturation happen. And to remember how to get that perfect WL, use our magical mnemonic APEX. A. Accurate radiograph. Start with a good, clear pre-op x-ray. P. Patency. Use a number 10 file to keep the canal open and prevent blockages. E. Electronic apex locator. This little device is your best friend inside the canal. X confirm. Always confirm your electronic reading with another radiograph. Now, let's talk about the apex locator. To get an accurate reading, remember the word DRY. D, dry the coronal part. R, remove debris, clean the chamber. Y, you must isolate. Rubber dam is mandatory. If you skip it, your instructor will appear behind you like a ghost. Use a number 10 or 15 file. Move slowly, gently, not like you're stabbing a vampire. Keep the lip clip stable. When the reading becomes steady, congratulations, you've struck endodontic gold. Next up, the glide path. This is the highway you build before you let your rotary files drive inside. Without it, rotary files snap like dry spaghetti. With it, they glide smoothly like butter on a warm pan. To create the glide path, remember SSP. S, scout the canal with a number 8 or 10 file like a brave explorer. S, smooth the pathway using a watch winding motion, gentle and controlled. P, prepare the path up to at least a size 15 before using any rotary file. All right, let's talk about apical patency. Patency keeps the very end of the canal open and free of debris. Think of it as light housekeeping, just keeping things clean for smooth instrumentation. To perform patency, remember FLOW. F, file number 10. L, light pressure. O, out and in movement. W, withdraw immediately. It's just a tiny kiss at the apex. You're not enlarging it, you're just saying hello and leaving. Now, common mistakes. First mistake, working length too short. This happens due to blockage, debris, ledges, or inaccurate readings. Second, working length too long. You've accidentally pushed through the apex, causing irritation and post-op pain. Third, no glide path. This leads to transportation, ledges, and worst of all, broken files. Nobody wants that. Time for a quick quiz. What's the mnemonic for working length? APEX. For the glide path? SSP. For patency? FLOW. If you got them right, congratulations, you're officially an endo wizard. And that's our adventure for today. You now know how to find the perfect working length, build a safe glide path, and maintain patency like a pro. Get ready because the next video is the heart of the entire treatment, cleaning and shaping. Let's keep saving teeth together, one canal at a time.